Our paper, which is called The Global Prevalence of Erectile Dysfunction, has two main messages. One is obviously focused on the global burden of erectile dysfunction, but equally there is a message around the use of homogeneous data in real-world evidence. So if we first have a look at our findings with respect to erectile dysfunction, it can be seen that the prevalence ranged from 3% to 77%, which is quite a huge range, and can be explained partly by the fact that we have various definitions used for erectile dysfunction. So some people use different types of validated questionnaires, but equally there are non-validated questionnaires. And in addition to the tool to measure erectile dysfunction, there is obviously variability in terms of the age of the study population or the disease setting, the geographical location. So that's one reason for this heterogeneity. Nevertheless, we obviously found that erectile dysfunction is associated with age, but equally cardiovascular mortality, overall death, and then there's also associations with BPH as well as dementia. Now, if we go back to this issue of using different tools to measure erectile dysfunction, that really brings us to an important point when we think about pooling data from various real-world evidence sources. This is a problem because often there are no what we call core outcome sets. So core outcome sets could be there either for clinically reported outcomes, or they could be there for patient-reported outcome measures, such as erectile dysfunction. And so it's very much encouraged to use core outcome sets, because then it is possible for policymakers to pool data together and actually draw some useful conclusions which can then have an impact on patient care. So in conclusion, what our paper shows here, that there is quite a burden of erectile dysfunction. If we look into the global prevalence, there is still quite a lot of variability, but this is partly due to the heterogeneity in the tools we use in real-world evidence, and so this is also a plea for using more homogeneous measurements going forward and pooling data from the real-world setting.